So still with the coronavirus worldwide, there are reports now that the virus is stopping parents from getting their children vaccinated for other diseases. They are concerned. Debora Patta has more.
Normally there'd be a lot more children at this clinic in Johannesburg, but many parents are terrified of bringing their kids in for vaccinations because they're scared of the coronavirus. And in other African countries, immunization programs have been suspended altogether, prompting fears we're swapping one deadly virus for another.
Cholera in South Sudan and Yemen, a strain of poliovirus in more than 30 countries, and measles outbreaks flaring around the globe from Bangladesh to Brazil. It is one of the most alarming consequences of this pandemic. As developing countries try to slow down the coronavirus, they are unintentionally speeding up the spread of other deadly diseases.
We're setting ourselves up for a parallel outbreak of other diseases, vaccine-preventable diseases, simply because children are not being immunized.
Leading South African vaccinologist Professor Shabir Mahdi says it's not just a developing world problem. Even in wealthier countries like the US, there has been a decline in immunizations during global lockdowns. Many countries suspended inoculation programs, fearing they would aid the spread of the virus. And even in countries that tried to keep them going, cargo flights transporting vaccines were halted by the pandemic. But it's also fear that is keeping many away. Like first-time mum Tumi Musiamedi, her 7-month-old Katleho has already missed his measles shot.
When was the last time you went to the clinic to take little baby Katleho for vaccinations?
3 months back.
3 months ago. And why have you not gone during this pandemic to the clinic?
Because I'm scared of this COVID-19. It affects me a lot because when I go with Katla to the clinic, many people outside of the gate, they don't wear masks. And when she coughed, I think that is COVID-19.
The irony is that measles is a lot more deadly than the coronavirus for unvaccinated children.
Once you start having these disruptions in terms of immunization services, even in high-income countries, it's going to lend itself to outbreaks of those viruses. Children don't usually develop severe disease from COVID-19, but they do develop severe disease when it comes to measles.
And the world has already seen the damage caused when inoculation programs are halted. In the Democratic Republic of Congo last year, more than 6,000 people died from measles during the height of that country's Ebola outbreak. As the pandemic hits Africa hard, Congolese health workers are trying to prevent a repeat of last year's measles epidemic. On foot or motorbike, even by canoe, they are fanning out across the country to vaccinate children. Because if countries do not start closing the gaps in their immunizations, experts warn the results will be catastrophic.
Each day, there's going to be about 6,000 additional children that will die because they're not getting access to essential healthcare services, including immunization. They estimate that over the next 12 months, anything between 250,000 to 1.2 million children will die.
It's a tough balancing act, preventing a new deadly virus from spreading, whilst making sure an old killer does not get a foot in the door.
The World Health Organization recently released a survey which showed 80 million babies under the age of 1 are at risk of missing routine immunizations due to the pandemic. Now countries are scrambling to play catch-up in a bid to avoid undoing decades of progress against vaccine-preventable diseases. Anne-Marie?